Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop tarsal tunnel syndrome pain or relieve tarsal tunnel syndrome pain. But before I do that, I'm gonna go over the symptoms, the causes, risk factors, normal healing cycle, and then we're gonna get to the root cause of tarsal tunnel syndrome pain and what you can do at home to relieve your pain. So basically, what is a tarsal tunnel syndrome pain? It's very simple. It's your posterior tibial nerve is compressed or squeezed. As you see in this image, the posterior tibial nerve is passing here from the inside of your ankle. So when you look at your ankle, your big toe is here, and the nerve is going from the inside, the inward of your ankle. So tarsal tunnel syndrome, it's basically compression of the tibial nerve that passing here. You might experience some pain, numbness, tingling on the inner part of your ankle and also on the bottom of your foot. So the risk factors or the causes of the pain due to compression could be from ankle sprain. You sprain your ankle and your body start to build a lot of inflammation, scarring around the tarsal tunnel, and that's compressed on the tibial nerve. And also could be from excessive pronation. So when you look in this image here on the bottom, you will see neutral normal alignment between your calcaneus and your leg. It should look like this. So when you have pronated foot, it's basically your fascia is collapsing, like the first image here, that could pull or stretch around the tarsal tunnel and cause a lot of scarring and inflammation that push on the nerve. Supination is excessive supination here. You can see it in that image, but the most common risk factor is pronating, excessive pronated foot. Also, if you are diabetic or have arthritis or gout, that cause inflammation in the tarsal tunnel, and it actually could compress on the nerve here. Also, some patient might have a varicose vein that's around that area that cause inflammation. That's also a risk factors. So symptoms: you might experience some numbness and tingling, shooting pain that's inside your ankle, and also you will feel it on the bottom of your foot, and tingling. As you can see, the difference between normal tissue here and the tarsal tunnel, that there's something compressing here, and usually it's inflammation or scar tissue. So how to get to the root cause of tarsal tunnel syndrome? Well, before I answer this question, we need to understand the normal healing cycle, so it will make sense how to get to the root cause of the issue. So I'm gonna go over the normal healing cycle, so you will see what's happened internally in the tarsal tunnel, so it will make sense what we can do to treat the root cause of the problem. So the first stage of healing is called inflammation. That's when you start to have swelling, redness, the blood starts to rush to that area, and you can see it here with the paper cut. The second stage of healing is called proliferation stage. That's when your body starts to build a scar tissue. You can see it here. And during that stage, there's actually a cascade of events: fascial restrictions, muscle spasm, and trigger point. I'm just going to focus on the scar tissue for the sake of our time, but the treatment has to address all of these issues simultaneously. So why scar tissue could be an issue? Because our muscle should act like a rubber band. When it contracts and relaxes, stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contracts, it will not stretch much. The problem is with the tarsal tunnel syndrome, that scarring gonna compress on the nerve and will cause the numbness, tingling, shooting pain to the foot and the ankle. Perfect scenario, actually, during the maturation stage, our body should get rid of everything. from the proliferation stage and the inflammation stage. That could take days, weeks, months, or years. And with chronic condition, usually the body going back and forth between inflammation and proliferation. And you can see here in this image, you start to have an irritation here in this area, so you start to have swelling. And if you have a micro tear, your body gonna build the scar tissue, and that's gonna compress on the nerve. So to visualize the scar tissue, normal tissue should look like this. You can see it like very nice and smooth. That's specifically for the muscle here. When you start to have a micro tear, it's happened randomly, very small tears here. Your body has to build the scar tissue to glue things together. And when that happened, it happened very random here. The problem is with the tarsal tunnel, you don't have enough room for your body build the scar tissue there. So when you have 1 to 2 millimeters of scar tissue, that could cause compression on the nerve, the tibial nerve, and cause that numbness or tingling pain. So how to treat the root cause of the tarsal tunnel syndrome? Before I answer this question, I'm gonna go over common treatment that's been used that's not very effective, and we'll relate that to the normal healing cycles, so it will make sense why we should not use this treatment, because it's not providing the root cause, addressing the root cause of the issue. So common things used is a stem, heat, and ice. And when we look at the normal healing cycle, that's not going to do much to the proliferation stage, the scar tissue. And it's temporarily going to decrease pain, but it's not really addressing the root cause of the problem of inflammation and proliferation. And based on several studies, it either provide temporary pain relief or no pain relief. The other thing that's commonly used is massage and foam roller. And when you look at the healing cycle here, if you have inflamed area and you keep rubbing it, that will cause more inflammation. So, and based on the studies, a foam roller and massage either provide short-term pain reduction or no pain reduction. And when I go over the fascia system, it will make a lot of sense why massage and foam roller are not effective. The other thing that commonly used is stretching. Think about this way. You have a micro tear and you keep stretching it, that will tear it more. And based on the studies, stretching could cause more inflammation. And I personally do not recommend stretching for any of my patients. There are safer options than stretching that can be used instead of causing harm with stretching for the tarsal tunnel syndrome. The other thing that's been used is joint mobilization, used by physical therapists, chiropractor, occupational therapists, and that's basically moving the joint. So, but when you think about this way, if I move the joint, that's not going to decrease inflammation, that's not going to break down the scar tissue or fascia restrictions. It's actually, if it's inflammation in the joint itself, it could cause more inflammation, and it's not really addressing the root cause of the problem. And when we look at several systematic reviews and studies, it shows that joint mobilization either provide short-term pain reduction or no pain reduction. The other thing that's been used is strengthening exercises. But the problem is, if you introduce that on the wrong timing, when you have inflammation, you're going to inflame it more. But what I prefer is something called function training that's much more effective than strengthening exercises. But strengthening exercises not going to break your scar tissue, release your fascial restriction. It's not going to decrease inflammation. It actually could cause more inflammation. So, in order to treat the root cause of the problem, we have to break that vicious cycle from both ends, because tarsal tunnel, it's compression on the nerve, and that's very commonly happen due to inflammation, scarring, fascial restriction, muscle spasm trigger point. So, in order to do that, the first thing we need to do is work on the inflammation. If you have a minor case, just rest for a week, and that should be good enough to decrease the inflammation and calm things down. But after a week, if you're still experiencing pain, that's a sign you have chronic condition and your body going back and forth between inflammation and proliferation stage. In that case, we need to be very aggressive on decreasing the inflammation and releasing the proliferation stage. So what I personally do is I give my patient the MagnaHeal 2. This is very strong magnetic device that actually the magnetic field about 3 inches that penetrate in the body, and I use that on the ankle to decrease the inflammation on the ankle. At the same time, I use the pain relief cream. It has several vitamins and minerals that decrease inflammation. I use it simultaneously with the MagnaHeal Pro, MagnaHeal 2, and at the same time, I like to put my patient on anti-inflammatory diet because there's certain food that we know, like refined carb, refined sugar, and other food that cause internal inflammation in the body for 5 hours after eating. So I like to put everybody on anti-inflammatory food diet to make sure that they actually not eating something that they slow down their healing. For severe cases, and that's usually if your pain level from 0 out of 10 is 7 or above 7, that's a sign that there is a possibility of internal vitamins mineral deficiency, and the body is not having enough fuel to heal. So at the same time, while I'm working on external inflammation by decreasing localized inflammation, I like internally to decrease the inflammation by meeting the common deficiency that cause slowdown of the healing cycle, and that's usually addressed with the anti-inflammatory supplement kit that include collagen, magnesium, omega, C, D, and other vitamins and minerals that commonly deficient with the patient with severe condition. So at the same time, while we're addressing the inflammation to break that vicious cycle, we have to work on the proliferation stage. To break the scar tissue, I personally use the A3 that used to break superficial scar tissue. And for the deep scar tissue, fascia restriction, and trigger point, I use the A5. And that's why I said massage and foam roller are not effective, because mechanically impossible to go deep to break deep adhesion in the muscle or the tissue with the hand and fingers. So I can do that with the with the A5. Especially when we work on the tarsal tunnel syndrome, we have to release the calf, and that calf muscle could be tight, that pulling the leg outward or inward, that causing more symptoms. So I can do that with the A5. So the other thing we have to work on simultaneously is the fascia system. Briefly, I'm gonna explain the fascia system here because it has significant effect of tarsal tunnel syndrome. So the fascia system, as you can see here, the white web tissue here, that's the fascia layers. And when you go by a meet next time, look at the white filament here. That is the fascia layers. So to make things complicated, but don't worry, the treatment very simple. The fascia system consists of two big categories. One is superficial layer and the other one is a deep layer. The deep layer is divided to 4 subcategories, which are apparetic fascia, epimysin, premiysin, and endomysin. To make things more complicated, each of these layers has 2 to 3 sublayers on the top of each other. So the apparetic fascia wraps a group of muscles, and then we have the epimysin wrapping each individual muscle fiber. Then the premiysin wrapping in a group of bundle of fibers. Then at the end you have the endomysin wrapping each individual muscle fiber. So that's why I said massage, foam roller are impossible to release fascia restrictions or deep adhesion, because mechanically impossible to go deep to the apparetic epimysin and premiysin and endomysin and release it with the hand. So what I personally do is I use the A1 to release superficial and apparetic fascia, and then I use the A5 to go to the calf muscle and release the apparetic fascia, epimysin, premiysin, endomysin. So to sum it up, how we stop or treat or relieve tarsal tunnel syndrome. Well, first of all, just rest. If 1 week is not enough to decrease your symptoms, that's a sign you have inflammation and proliferation, and your body going back and forth between inflammation and proliferation stage. And you need to be aggressively to break that vicious cycle from both ends. At the same time, we want to correct the pronated foot. There's certain exercises that can be done for that, and wearing a good supportive shoes. I will go over the shoes and pronation correction in other videos, but you have to really address all of these simultaneously. You cannot pick and choose. I will work on inflammation and that will resolve the issue, because usually when you have inflammation, you have a lot of scar tissue, fascia restrictions, and muscle spasm. And that's conclude our video on how to treat tarsal tunnel syndrome. If you have any question or comment, leave it in the comment section below and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.